Well, that's a PSA produced by some group called marijuanaharmsfamilies.com, opposed to California's Proposition 19 that would legalize marijuana in that state. We don't know who they are, but we do know that there is a former Surgeon General who's come out in favor of Prop 19, and she joins me next. Joycelyn Elders, former U.S. Surgeon General, is also now a professor emeritus at the University of Arkansas School of Medicine and an associate at Arkansas Children's Hospital. She's joining us from Little Rock. Joycelyn, thanks for joining us. We're very glad to have you. Quick response to those who say those things. It harms children, it's a gateway drug, and it'll just do terrible things to law enforcement.
I would say that if it does anything, it would help law enforcement because they could spend more time taking care of people who are doing very harmful things. The Proposition 19, as I understand it, is really for adults over 21. They can have only 1 ounce. It's to be smoked in their own homes or in a place that's licensed or authorized. Now, the drug cartels regulate who buys the drug, and if we regulated it or decriminalized it, it could be sold and taxed, and we could use the money to do more valuable things for our bright young people.
But what about the fear of the impact on young people? You're an associate there at a children's hospital. A lot of parents, not even very political folks, but parents are worried, if they smoke marijuana, who knows what happens next?
Well, they don't mind that they smoke alcohol, drink alcohol, that they smoke cigarettes, both of which are much more harmful. Marijuana has been used for 5,000 years. It's never been associated with a toxic death or death from marijuana. So I feel that it's more of a medicine, and we should use it, regulate it, tax it, and stop all of our fears and our myths that are going on.
So regulate it just like alcohol. No one's saying it's going to be made available to, young tots or anything.
That's at over 21. We say we don't want people over 21 drinking, but we know that they do. We don't want them smoking. We know that they do. And both of those things are much more harmful than marijuana.
How did you come to this opinion? Did you always think this way?
Well, I reviewed the literature years ago, and I'm saying at least 15 or 20 years I have been at this opinion, and I feel that it should be legalized because I feel the only thing that our harm reduction policies have done is criminalize a lot of bright young people, put them in jail, and we're wasting all of our time and money chasing after marijuana users who really are not violent, not nearly so violent as alcohol. I read what it does to our brain. It's not a gateway drug. That's been shown over and over again. And I think that we need to stop, review all that's been done, or do more if we need to, and legalize this drug, tax it, and use the funds for useful services.
Joycelyn, this isn't the first time you've taken a controversial position. Your position on masturbation, saying that it wouldn't be out of place in public education, got you fired from the Clinton administration back in the 1990s after just a year. Right now, we have a candidate running in Delaware, Christine O'Donnell, who has gone on the record saying she thinks masturbation is evil and, the devil's work. What do you think about this debate? And do you think if people had stood up better for you then and masturbation, we'd be where we are today?
Well, I think that masturbation never got anybody pregnant, does not cause hair to grow in your hands, does not make anybody go crazy. And what we're about was preventing HIV disease and our bright young people. And, they said, I said the chapter are teaching about masturbation. Nobody has to teach anybody how to masturbate. God taught us how. So I think that now even in Africa, they're saying that maybe this is something that we should stress more of for couples, and we know that they do already.
Finally, you were the first African American Surgeon General. How do you think we're doing? Have we progressed in our understanding and discussion around healthcare in the years that you've been in the public arena?
I feel that we have done much to discuss and increase the understanding around healthcare. I'm very pleased that we have a healthcare reform bill finally passed. It's not what we want. We want universal access for everybody. Healthcare should be a human right. But I think if we have a bill, we have something that we can work on and try and make better. We are the only industrialized nation that requires so many of our people to not have access to a basic human right like health.
Former U.S. Surgeon General Joycelyn Elders, thanks so much for joining us. We've got more information about this debate and much more coming up right here on GRITtv.